Ladies and gentlemen, hello and welcome. Thank you for attending today's webinar, Future-Proofing Technology for Flattening the Curve of the Pandemic at the Point of Care. Before we begin, I'd like to cover just a few items regarding this webinar platform. At the bottom of your screen, you'll notice a handful of widgets, mainly the Q&A widget, which you can utilize to submit any questions you have throughout today's webinar session. For viewing purposes, you can also expand your viewing window by clicking on the icon found at the top right corner of the slide viewer. If you have any technical difficulties, please click on the Help widget. And lastly, do take a moment to fill out the survey at the end of the webinar. Thank you. We're going to go ahead and just give it a minute before we proceed, at which point I'll turn it over to presenter, Mr. Rob Schwartz.
Before we get started, Rob.
All right. Hi, Brendan.
Hello, Rob.
My name's Rob Schwartz. I cover the federal healthcare account of the Department of Veterans Affairs for Insight. It's my pleasure to have Brendan Coughlin on the phone today and on the video chat. And we're going to cover a very exciting topic that is very pertinent to our times right now as we look at mobile devices and global telehealth. Brendan, would you like to introduce yourself?
Yeah, hi. Thanks, Rob. My name is Brendan Coughlin, and I'm the Executive Vice President and General Manager of Global Telehealth Services. We're a telehealth and remote patient monitoring software company based in Cleveland, Ohio, actually Hudson, Ohio.
Well, Brendan, this is an exciting time for telehealth. This pandemic has really brought forth a critical tipping point for remote health monitoring, and the demand for this capability seems to be increasing exponentially. What do you think really is driving this demand?
Yeah, certainly COVID and the coronavirus epidemic have been a huge catalyst for telehealth and remote patient monitoring. You know, interestingly, telehealth and remote patient monitoring have been growing at a pretty fast rate over the last few years, but this pandemic has certainly been the catalyst for greatly accelerated growth. So a lot of it has been driven by the market. I mean, the technology is already in place. There has been fairly decent adoption of this technology, a lot of people are aware of it and analyzing it. But you know, certainly the biggest catalyst has been the fact that the country now has many infected COVID patients, and the health systems absolutely must minimize exposure within their systems to infected patients. The worst thing that can happen in a hospital system is getting healthy doctors and nurses sick with the COVID virus, as we've seen in several markets. So the need to reduce exposure to infected COVID patients has been really what I call kind of the bucket of gasoline on the campfire that has dramatically accelerated adoption of telehealth and remote patient monitoring just in the last 3 or 4 months.
So this remote patient monitoring, or RPM, what do you think really causes this to expand? Is it that we have this capability now for everyone working remotely? Is it really the capability of the devices to connect, or is it really an aggregate of all of that, Brendan?
Yeah, those are all good points, and I think it is a combination of many factors. Certainly, it's based on the fact that the technology exists today, and a lot of the technology that's being implemented for telehealth and remote patient monitoring isn't new. It's been around for a while, but there is widespread adoption and acceptance of the types of technologies, whether it be phones or broadband or Bluetooth-enabled vital monitoring devices or tablets. I mean, all the different technologies there that allows these types of software platforms and technologies to be utilized in a very effective way. Another part of it, too, is just the fact that the market for remote patient monitoring and telehealth has grown. There's been a lot of new companies that have come onto the scene, a lot of investment in the area, and therefore a lot of marketing that's been done in the area. So investment and awareness have also contributed to the widespread adoption. The other big driver has been the effectiveness of telehealth. Certainly utilizing the technology is one thing, but it's become clear that telehealth and remote patient monitoring can dramatically reduce hospitalization costs and reduce the costs of that 20% of the most chronic condition patients in the country that typically make up about 80% of the cost to the current healthcare system. So the utilization of this technology has been proven to be extremely effective in reducing costs in that most expensive group of people in the healthcare system. And then finally, like we talked about, has been COVID-19. COVID-19 has been a big catalyst, and we've seen you mentioned exponential growth. We truly have seen exponential growth in telehealth and remote patient monitoring in the last 3 or 4 months. We've talked to numerous hospital systems that were, at tens of telehealth visits on a daily or weekly basis, now having thousands of telehealth visits on a monthly basis. So we truly have seen exponential growth in that area.
So before I ask a question, Brendan, can you lay out kind of the historical footprint of telehealth? Because I'm kind of familiar with, in the VA, we had the blue button. We watched some of the Vocera devices come in to play, with the staff and everything. We've seen attempts to have some type of video comms communication. What's really been the kind of the 3 distinct platforms as this market has evolved?
Yeah, and that's a good question. There are a number of different platforms that I'll talk about, and there's kind of been a convolution too of the terminology. Telehealth means a lot of things to a lot of different people. And as I think about telehealth, if you look at kind of the traditional telehealth market, it's simply teleconferencing. When most people hear telehealth, they think of maybe teledoc, which is the ability to call up your doctor, either have a phone call or a video conference with a care provider, and they can do a simple diagnosis. They can prescribe medication. Those are sold through insurance policies. That to me is kind of traditional telehealth. But as a subcategory of telehealth, you also have remote patient monitoring. And that's largely been driven by the makers of devices that capture vital data. And there's lots and lots of manufacturers of vital monitoring devices. Some of the big guys that people have heard of might be Medtronic or Philips or GE, or there's a whole wide range of them. And all of these device makers have created their own data capture platforms to capture vital data from their devices, but these are typically closed systems, meaning that these device makers are not going to allow devices from another manufacturer onto their platform. So that's really number 2. You've got remote patient monitoring, which is a subset of telehealth, but only for the closed systems or single manufacturer platforms. And then you've got the third style, or the third type of platform, which is a device agnostic platform. And this is really where the growth is happening right now, and where we've invested a lot of time and effort in developing our platform to have a completely device agnostic platform, which is really the opposite of what I just described. So with our platform, and there's a few other competitors that we've seen on the market that have entered in the last year or two, but with our platform, we don't sell hardware. We simply have created a unified platform that allows any device to be integrated so that that data can be captured in a single place. So we can literally integrate any Bluetooth-enabled device, any USB device, any Wi-Fi device into our platform, allowing data to be captured in a single place, which is great for hospital systems and organizations like the VA that you mentioned that have invested in dozens, if not hundreds, of different device makers that are struggling with all of these different data capture platforms that are unique to the specific manufacturer. So with a platform like ours, all of that data can be now captured in a single platform. So those are really the 3 different types.
So, and Now I'm going to ask a question, Brendan. So as we look at COVID and the need for the hospital systems to protect their providers' exposure, because the provider to the hospital is a very valuable resource, and when those resources leave, it's very difficult to backfill. But we also see people that come in with symptoms and potentially get sent home. So I could use your platform to monitor people at home, yet use it inside the hospital to protect the staff from less contact with the COVID patients and minimize contact. Kind of have the best of both worlds. Is that kind of
that's right.
Correct for me to think?
Our platform can be used both as an inpatient and an outpatient platform. In fact, it was originally conceptualized as more of an outpatient platform to help monitor and manage chronic condition patients. But in light of COVID, it can be used as an inpatient platform as well to, as you said, minimize contact with infected COVID patients. So in a hospital setting, if you have a COVID patient that's in their room, the hospital's trying to dramatically reduce, if not eliminate, face-to-face contact with those sick patients. So with a platform like ours, the doctors and nurses can not only monitor the vitals, capture the vital data from that patient from outside the room, but they can also do the telehealth visit, the video conference through our platform as well. So it really captures both elements of telehealth, the remote patient monitoring, as well as the teleconferencing on a single platform. And all of that can be done from outside the room, which is perfect for a situation like we have with this pandemic.
Thank you for clarifying that, Brendan. Now, and are there some differentiators that we see with the platform as far as what we need for successful adoption? Obviously, your platform is open and kind of built so that they can come in here. But what are these differentiators that we need to see really a successful large-scale adoption?
Yeah, there's a number of them, but I think the biggest three are probably the following. I'd say number one, a platform that's customizable, being able to not only integrate a wide variety of different devices, but being able to customize down to the patient level. So, not all patients are going to fit into a specific vital monitoring range. Different patients have, different blood pressure rates, and they're generally the same, but they're not all the same. So a platform that allows the ability to customize down to the patient level, being able to integrate multiple different devices, being able to monitor and set up organizations based on the needs of that organization. And an organization like the VA, for example, highly distributed throughout the country, but at the same time, they might want to be able to capture all patient data at a single level. So being able to manage and monitor at the organization level as well. I'd say number two, and I touched on this, is device agnostic. There are a lot of data capture platforms out there that are unique to different device makers, but a platform that can capture vital data from any device would certainly be advantageous to larger systems that have made big investments and will continue to make investments in a wide variety of device manufacturers. Being able to capture all that data in a single unified platform would certainly be advantageous. And then finally, certainly the ability to integrate with an EMR. Our platform can integrate with almost any EMR, but being able to have a platform that integrates almost seamlessly into a workflow and have that data ultimately pull into the patient's clinical record is another big advantage. And there's more, but I'd say those are probably the big three.
Absolutely. Well, thanks for the primer on this. With your permission, I'd like to, we'll get to the meat of this with a couple slides.
Absolutely.
All right, I've got slide 2 up, and Brendan, it looks like a plethora of devices here. So is it true that I can support just about any device? I see a smartphone, a card, a tablet. Tell me about the card.
Yeah, that's right. Well, let me address the first part. Our platform can work on any device, any Apple device, any Android device, and any Windows device. The app for the patient-facing side is downloadable from the Android store or the Apple store, and again can work on really any device out there. On the care provider side, that's a web-enabled portal that can also be accessed from any computer, any tablet, any phone. Now, with relation to the cart was a request actually that we got from the Veterans Administration here in Cleveland. They had actually thousands of these mobile carts that they've been using in their medical facilities, but they needed them to be able to be used in a more remote way, being able to use them within the medical facilities, being able to be moved from room to room. And they had to work on Windows because these carts are driven by computers that are Windows-based. So they asked us to develop a Windows client version of our platform, which we did. And now with our platform installed on these medical carts, these carts can be truly mobile, remote patient monitoring and telehealth carts that can be moved from room to room.
And then that allows they look expensive, so I can then fully amortize the value of that cart over the years now that I have really this connectivity issue solved with the carts.
Yeah, that's right. I think the biggest issue had to do with the fact that these carts, and this is again just in the VA, but the carts had to be plugged into a network port, and with our platform, we've integrated the video in a way that it doesn't require the port to be, or the plug to be entered into the port within the room, and therefore it can be moved and transported and still connected via Wi-Fi as it's moved from room to room.
That's really cool. I mean, I know it's been an evolution to get Wi-Fi into the healthcare systems, and certainly Bluetooth connectivity on devices, and occasionally the government institutions are a little slower than other organizations, but not really too far behind.
Right.
Oh, I got too many slides there. So now, sorry about that. On slide 3 here, I see lots of devices. All these devices can connect. So via Bluetooth, what do you want to educate me on how this actually works, Brendan? So all these devices have Bluetooth connectivity, and how do we get connected into your platform?
Right. So I'll start with Bluetooth, and there's a great trend of vital monitoring devices having Bluetooth technology integrated into them. So while we focus on Bluetooth, we can essentially integrate any device, whether it's a Wi-Fi device or even a USB device. In fact, on those mobile carts that we were just touching on for the VA, they wanted us to integrate a USB camera, a high definition camera, as well as a streaming stethoscope, which was also a USB device, which we were able to do. So it's just a matter of understanding what device it is. We have to contact the manufacturer. They have to give us access to what are called their SDKs, which is the data or the programming language for the Bluetooth connectivity. And within a matter of days, we can have really any device integrated into our platform. So while it does require the cooperation of the manufacturers, we have yet to talk to a manufacturer that wasn't willing to share that information with us, because ultimately they want to sell more devices.
And is Bluetooth seemingly the standard at this point for the manufacturers? Is there another standard or any other like non-Bluetooth standard that you can see in the future for connectivity?
Not that I'm aware of. I think Bluetooth is certainly the current trend, and will probably stay that way. Wireless is obviously better. And as we see on this slide, most of these are kind of traditional vital monitoring devices. You've got a blood pressure cuff, you've got a thermometer, you've got a pulse oximeter, you have a glucometer, which are all standard, very commonly used devices. But we're seeing things like devices even put in the body, like stents, heart monitors. Those things are also being Bluetooth enabled and can also be integrated and utilized in our platform. We're seeing more and more wearables. We're seeing watches. We're seeing rings. There are a number of companies that have come out with a device that will stick on your chest, or some type of sticker device that also emits the Bluetooth signal that can also be integrated into our platform. So, not only we chose not to get in the hardware business for a number of reasons. Number one is it's an enormous market. It's moving very, very quickly, but we just wanted to focus on the software side of it and create this unified platform. So we'll let the hardware manufacturers deal with all the hardware. We're simply going to integrate that technology into our platform. But Bluetooth, I think, is the trend. It's certainly here to stay, and I don't see it changing, at least from what I've seen so far.
Good deal. I'm going to advance the slides. So, gosh, I have been, like everyone else, been stuck at home and not traveling, and using all of this different kind of video conferencing. So it's pleasant to see that there's video conferencing on your platform. What really makes this different from a regular Teams meeting?
That's a good question. Yeah. So number one, this is a fully compliant, fully HIPAA compliant platform. As we've seen in the coronavirus pandemic, the HIPAA restrictions have been lifted, but it's more than likely that at some point the HIPAA restrictions will be re-implemented, and things like Zoom and potentially Teams, and unless they make some significant adoptions to their platforms, those are not HIPAA compliant platforms, things like FaceTime and Skype and things like that as well, that are currently being used today in a medical setting that otherwise wouldn't be able to. We have integrated, and this really touches more towards the VA, but we have integrated PEXIP, which is a video platform, a HIPAA compliant video platform that the VA has a very large license to and a contract with. But our platform, just like our devices, we can integrate virtually any embeddable video conference technology. We've embedded the VIDYO platform. We've integrated PEXIP, and there's a few more that we've integrated as well. And if a client has a specific request, we can integrate other video platforms as well. The other thing that's unique about our platform from a video conferencing standpoint is that the doctor has to initiate the video call. One of the things that we've heard from not only the VA but also hospital systems that we've spoken with is, a lot of hospitals have adopted things like Zoom. They've adopted utilization of FaceTime, Skype. Not only does that require care providers to give out information that they may not otherwise want to give out, but it also allows the patient to initiate a video call, which can be very, very disruptive to the schedule and the workflow within that system. So in our platform, the patient can request a video conference, but they can't initiate a video conference. A video conference can only be initiated by the care provider. So as the patient requests that video conference, there's a messaging function within the platform. The care provider can get back with them and say, okay, I'm going to call you at 2 o'clock or whatever. And that allows the care provider to build that video call into their schedule, into their workflow, and it'll be far less disruptive than otherwise it might be if the patient can initiate it. The other thing that's really, really unique about our video conferencing platform and the way we've integrated it into our system is, while a doctor or care provider is having a video conference with a patient, the patient can take vital sign readings and have those readings display up on the screen. So if you've got a COVID patient and they're in recovery, for example, but the doctor doesn't want to go in the room, they can have the patient pull out their thermometer and their pulse oximeter, and they can see those pulse oxygen readings and those temperature readings show up on the screen without the doctor actually having to go into the room to take those readings for them, or the nurse or the care provider or whoever. So having live vital readings up on the screen is another big unique differentiator in our platform.
And that would really help on pre-screening for surgeries and other things too.
Absolutely. Absolutely.
Right, the stress of going to the healthcare provider's location and knowing that you're going to have a procedure tends to elevate people's blood pressure. So I think you could get almost a consistent baseline here prior to a procedure.
Yeah.
So really fantastic that you're capturing all this. Mm-hmm. So if I had let's say the gentleman in the picture here is obviously talking to his doctor. Would he be able to have, say, his spouse involved in this type of video conferencing with the provider?
Not in the conference per se, but our platform does have a third app called SmartShare, where we allow the patient to invite family members or friends or outside clinicians into the circle of care. So imagine you have a parent, then maybe they're an older veteran and they're living by themselves at home, and you're living across the country. Well, if the VA doctor has prescribed a telemedicine and remote patient monitoring platform to them and regimen that they want them to do on a daily basis of taking their readings, the family member can also receive those readings, make sure those readings are in compliance and that there's nothing that's kind of going sideways with their parents' health, but also make sure that they're even taking those readings. So being able to invite family members into the circle of care for the patient is another very unique feature in our platform that we haven't seen in some of our competitors' platforms.
Absolutely. That seems to be a real differentiator. So
yep.
When I look at use cases, there seems to be just a plethora of things that could go on inside the healthcare system with this platform, both inside and out. So what do you think are the most usual use cases for you to see that are probably the most general at this point for an easy adoption?
Yeah, we've touched on a few of them today. As I mentioned, our platform was initially conceptualized to do traditional remote patient monitoring of chronic condition patients. Folks that have diabetes, they might have obesity issues, they might have heart conditions, they might have hypertension, some of the more traditional chronic conditions that are very, very expensive for the healthcare system. And again, our platform was conceptualized to help doctors intervene before the vitals got to a point that required the patient to make a hospital visit, and it's been very, very effective in reducing hospitalizations in chronic condition patients. So your typical remote patient monitoring chronic condition use case is certainly a big one. Provider-initiated telehealth is another one. We're seeing huge adoption today of telehealth and the ability of doctors to communicate with their patients via phone or via a video conference. And again, our platform requires the doctor to initiate that call. We touched on this as well, COVID patient monitoring. This would be kind of an inpatient use case where infected COVID patients within a hospital, and this could apply to other things outside of COVID too, by the way, but our platform could be used in a setting where the patient either needed to be, quarantined essentially from their care providers, or they needed rest and simply, couldn't be disturbed. But the point is that the platform can capture vitals and the patient can be communicated with from outside their room. And as you touched on a moment ago, Rob, as a screening device, if you've got a patient that maybe thinks they have COVID, they can request a video conference with their care provider, and our platform can be reused as a screening tool to determine if a patient might have COVID. So let's say that they already have received some of the vital monitoring devices. If they already have a Bluetooth thermometer, a Bluetooth pulse oximeter, or a Bluetooth blood pressure cuff, they could take those readings. The doctor could see up on the screen those readings and determine if those readings were indicative of that patient having COVID or not. So it could also be used as a screening tool. And there's other use cases that are out there, but I'd say these are probably the four most common that we're going to see. So
if I have an elderly parent and they're at like a veterans benefits home, and at some point they have some concerns about developing medical condition, I certainly could use this platform, communicate back through their provider network or via the nurses that are at the actual facility, and really then have that data shared with me. That seems like it would give me lots of peace of mind for my parent, and could get a baseline of how they're doing, and then we could watch any ups and down spikes or anything. So this really, I think this brings a lot of peace of mind to people from dealing with the provider network and everything that goes along with helping come along someone who has some illness.
Yeah, absolutely.
Thank you.
It gives peace of mind across the board to the patients, to the families, and even to the care providers. Typically, if in the example of the VA, if a veteran has to make a hospital visit, it's probably for a reason that is bad. And to the extent that the care providers can intervene and get that patient back on track from a health standpoint before they have to make that hospital visit, it's better for everybody.
Well, thank you. So, obviously, the federal government presents lots of different challenges when you think about a federal network. Where have you come to get basically credentialed to be on a federal government network?
Right. So we are currently approved by the Veterans Administration. The VA has sponsored us for FedRAMP, which is a additional certification that will allow our platform to be used in the medical facilities. We anticipate that being complete in the next 60 days. They've indicated they want that in place before the end of their fiscal year, which is September 30th. So hopefully in the next 60 days. But once we have that FedRAMP accreditation and our authority to operate within the VA, that also gives us the ability to operate really in any federal agency. So that opens up Department of Defense, it opens up HHS, Indian Health Services, you name it. We're currently approved for a traditional remote patient monitoring use case right now within the Veterans Administration. So anybody can acquire the platform as it stands today for an outpatient use case or for just traditional telehealth use case. The platform is currently being used in the VA in the Cleveland and St. Louis markets. We've been added to the RFI for the next 5-year telehealth contract. And as I mentioned, we have been sponsored by the VA for full FedRAMP authorization, which we anticipate having in place in the next 60 days.
Well, that's super strong work, Brendan, to get your organization prepared for really the reciprocity of having a FedRAMP inside the federal market. I see that we have a couple questions. Would you like to answer a couple?
Sure. Yeah, let's do it.
So first question, does this platform require an FDA 510K?
Yeah, it does not. This is because we are only a software platform. We are not a device. We don't sell devices. We're not a device maker. And because we integrate existing devices and our only software, our platform does not require any type of FDA certification. We're simply transmitting data from point A to point B through a secure HIPAA compliant platform through a secure cloud.
Okay. Let's see if there's some more questions here. Let me look down the list.
One thing, too, we've spent a little bit of time talking about the VA and hospital systems, but another big beneficiary of this type of technology is self-insured employers, organizations, whether they be state-owned or commercially owned organizations that self-insure. They are certainly as well looking to reduce the costs of that small percentage of employees that make up, probably in most cases, most of their healthcare costs. So, we're really focused on the payor side of the equation because that's where we can add the most value. But being able to reduce the 80% of healthcare expenditures from that 20% of patients is going to be, hugely beneficial for self-insured employers as well.
We have another question here. And I don't know if this is relevant or not, but does the device, it could incorporate like Fitbit data?
Yeah, we can integrate Fitbit. We've looked at the Apple Watch. I mean, there's all sorts of wearables that are going to be coming out to the market, and we can integrate those devices as well and read whatever those devices read.
Okay. So sleep studies, certainly the way that device gives you some sleep data, you could report that back as when someone asks you how you're sleeping, and sometimes people just say fine, slept okay, maybe I was a little restless. That device would give us a lot more data on whether the patient was really having a REM sleep, which
Yep.
we know REM is very important to mental health.
Yep. If the device generates data and is Bluetooth enabled, we can capture that data, regardless of the type of data it is.
All right. Well, Brendan, I don't see any more questions at this point. Do you have any questions for me? I know I've asked all the questions, but I'm supposed to do less talking. So
no, that's okay. Joe, if you could take it back to the first slide, I just wanted to offer to our attendees today, my contact information, Rob's contact information are here on this first slide. If anybody's interested in seeing a demonstration of our platform, we're happy to do demos for anybody that's interested in taking a look. We can do a fairly deep dive. It takes anywhere from 30 to 45 minutes, depending on the number of questions. The demo itself is 15, 20 minutes, and then we can have anywhere from 10 to 30 minutes of Q&A. So my phone number down there at the bottom and email address are there. Please take those and feel free to call, text, or shoot me an email. And if you're interested in setting up a demo, just let me know and we can set that up.
Well, thank you, Brendan, for your time. This is certainly a very exciting capability that is market ready now. And we here at Insight are proud to be your partners and walk with you in this journey of remote telehealth patient management. Thank you so much for your time today, Brendan.
With you as well. Yeah, thank you, Rob. Appreciate it.